Hello, ladies and gentlemen. Thank you very much for joining me today and hopefully the valuable webinar on natural treatments for your respiratory system. So we're not going to talk about treating specific respiratory problems as per medical terminology. We're going to talk about you diagnosing, first of all, and understanding your type of respiratory system. And we're going to break it down into certain categories. Of course, this is as per Ayurveda. So there's Vata type, Pitta type, and Kapha type of respiratory conditions. So we need to be able to classify our respiratory condition first. Then only can we talk about treating it. And of course, different types of respiratory symptoms as well, like coughing, sneezing, runny nose. So we're going to break it down first there. I like to focus on that because I think that's very important to understand your own condition. And then second, some home remedies that we can do at home to prevent our respiratory condition from getting worse. And I want to focus there because I see a lot of people making mistake in this area. And then, of course, we'll talk about some diet, a little bit on diet. And then, as usual, being an herbalist, I'll cover both Western and Indian herbs that can be used for treating various types of respiratory conditions. So we got a lot to cover here today. So let me just get started and let us classify and understand our own respiratory condition. I'm assuming people there are either treating others for respiratory problems or you yourself have a respiratory condition. So, it'd be good to get a piece of paper out and start to take some notes and classify and understand your respiratory condition, not just its medical term. So first, let's look at your respiratory system as in a whole. We don't have to look at even specific parts of our respiratory system, but just let's look at it first at a whole, including, our throat and our esophagus and, of course, our upper lungs, lower lungs, our bronchi and the alveoli. We can't see them, but we can feel to some degree which parts of our lungs and the condition of our lungs, the tissue of our lungs. So we're looking at the system in Ayurveda, the sotra, pranavayu sotra, our respiratory system, and then the tissue that's it's made of. In this case, it's type of rasa dhatu. This type in Ayurvedic terms is tissue that's forming our respiratory system, and the muscles, of course, are involved too. Mamsa dhatu. So we have certain tissue that makes up our respiratory system, and then we have the whole system and how it's functioning. So let's look at first the tissue, the condition of the tissue, the dhatu. So we want to classify it as per Ayurveda as either Vata, Pitta, or Kapha. So what's Vata? Respiratory tissue or your condition of your lungs is dry, cold, and maybe active. So dry, non-productive. So this is the first thing you should try to understand is you have a productive with mucus, which we're going to cover, more kapha type of condition, or dry, vata. So if you're dry, write down dry. If you're not dry, then maybe you're congestive, mucusy, phlegm. So that's a kapha, where you got phlegm, mucus, you're spitting out, you're in the morning, you have discharge there, you have a productive condition. So want to classify it there, dry or not dry, and non-productive or productive. This is very important, the first major category. Next, we can look at whether it's inflamed. Is there any pain or any burning sensation taking on, like it's painful? Or, of course, if there's blood coming out, then we know that it's damaged your tissue and your respiratory system. And that would be pitta. If there's any bleeding, that's pitta. If there's pain and burning sensation, that's pitta. So now we have three categories. Dry, can't breathe. It's also congested, but is dry. There's nothing coming out. Congested, kapha. Oh, sorry, no, can't clear. You have to steam it out. Breathing well through your snoring at night. That's kapha. You're blocked, but it's with mucus. When you take a hot shower, you clean it out. So that's kapha. That's the congested mucus type. And then the third type is inflamed, painful. And you can have both. You can have dry, vata, and painful. So now you have two imbalances. You have the dry qualities of vata, and you have the inflamed, burning qualities of pitta, which often indicates an infection. Or you could be congested, like kapha, with respiratory congestion and mucus, and difficulty breathing, and also have infection and pain, have a painful. So these are the three categories. You could be in any one of them, and technically you could be in all three. You could have dry cough plus mucus plus infection, and it's more serious. So if you just have a dry cough without infection or burning, then that's less serious than if you have both. If you just have mucus, but you don't have any pain or inflammation, then that's less serious than having them both. So you really need to classify it first in these three categories: vata, dry; pitta, inflamed; and kapha, congested with mucus, productive, or a combination. Then look at symptoms on top of that. Do you have coughing or no coughing? So generally, if there's coughing, then we have different herbs for that. Some home remedies I'll cover. And then, of course, we always want to look at whether it's an allergy or not an allergy. And that's very easy to determine. If you're having breathing going up steps and difficulty breathing all day, and it has nothing to do with the season or the spring or going outside, then it's more than likely a chronic condition. But if you're aware that when you go outside or maybe come inside of a room, you start to get sneezing, runny nose, and then either a productive or non-productive congestive respiratory condition. But you can see the trigger is something to do with the environment, whether it's pollen on the outside or dust on the inside, or a cat or a dog, or an allergy, in other words. So if it's an allergy, completely different treatment. Now, once you have an allergy, then we'll also need to treat the liver at the same time and give some herbs for the liver as well, and change the herbs completely if it's an allergy, respiratory allergy. So that's a very important classification. And like I mentioned earlier, we also want to classify whether we have an infection or no infection. Now, unfortunately, when we have mucus or congestion, we start snoring, having difficulty breathing. The doctor's talking about a CPAP machine. That's, type of respiratory congestion, usually kapha with mucus. Now that is creating the environment for infection. And same when you have difficulty breathing when it's dry. That's also creating an environment for infection. So, conditions can progress. There's a pathology as it progresses. So it's a little tricky, but hopefully you got yourself in a category there. That's the most important, because in Ayurveda, you always are treating the opposite. And that's what we're going to talk about, how to treat. If you have a dry cough, it's very different than if you have a wet cough. The herbs are different. The diet's different. Everything is different. So if you have asthma and it's productive and a lot of mucus, it's completely different than one that's dry type of respiratory condition. So let me talk a little bit about causes of respiratory imbalances, you say. So we're not even using the word disease. We're saying imbalance at this point. It's too dry, too mucousy, inflamed. So it's imbalanced. And now it's affecting your respiratory system and you're having breathing problems. And if you don't resolve it, there's a pathology where it will continue to get worse. And, ultimately that mucus could become an infection. The infection can become pneumonia, and, it can progress. The best thing you can do with any respiratory system is treat it quickly in the very beginning to not allow it to continue on its path. So hopefully this will give you this knowledge to treat these respiratory conditions in the early stages to avoid. So one of the common causes of respiratory problems is actually tissue depletion. That's right. So if you're weak, underweight, thin, don't have much body fat, and you're dry and dehydrated, then your lungs are dry and dehydrated. The tissue that's supporting your lungs is depleted. So you're going to have this type of respiratory problem that's difficult in breathing. In fact, if someone talks to me on the phone, they say, yeah, I have a dry, difficult to breathe respiratory system. I say, are you thin? and underweight and have dry skin? They go, yes. How'd you know? Well, because the tissue is depleted. So another common cause, we're talking about causes now, because that's always the best treatment. First, don't jump to the herbs. Don't jump to diets. Don't jump to some quick home remedy. Try to remove the cause. And you have to identify the cause. So if you are depleted because you're over-exercising, overworking, not eating enough, fasting too much, you're thin and underweight, then you could not only be affecting your respiratory system and depleting it, but other systems in the body too. But another common reason for respiratory system problems is suppressing the urge to cough. That's right. Just like with a urinary tract, we know that if we hold our urine in and don't go to the restroom, then we'll become more susceptible to urinary tract infections. So the same if we have a sneeze or a cough and we hold it in repeatedly, then this can create damage to the tissue and ultimately affect our respiratory system. And of course, dehydration and dryness is a very common cause of respiratory problems. And that would include excess exercising, excess jogging, where we're breathing deeply and quickly. So, and then of course, on the other hand, insufficient exercise and breathing practices, not using all of the lungs by not exercising enough. So over-exercising and under-exercising both can have adverse effects on our respiratory system. And of course, swimming or bathing in cold water can have an adverse effect on our respiratory system. And I'm going to emphasize that's very important to not expose yourself to cold in almost any type of respiratory system. So even prolonged exposure to cold air, even just too much cold food. I get a lot of patients and they have respiratory conditions, mucus, and maybe asthma or bronchitis that's been going on for decades. And I find that they're just eating cold food at home, a lot of ice cream at night. And this is probably the cause of their respiratory condition. Now, of course, it's in an advanced stage. Just stopping the ice cream may not be enough, but removing the cause is always the first line of treatment. And of course, coffee, alcohol, and smoking anything, tobacco, marijuana, are all adversely affecting the respiratory system. And, steroids and other types of medication can also damage it. And of course, the inhalation of pollution and toxins, particularly carbon monoxide, and the resulting carbon monoxide poisoning can, inflame and damage the inside of our, the alveoli and our ability to absorb oxygen. Mold in the room, allergies, allergenic substances, pollen, dirt, dust, entering the respiratory tract. All these can also be causes. And even too much stress and very cold weather is a very common cause. Air conditioners are often a cause of respiratory problems, cold air. So, we want to remove these causes. No matter what your respiratory problem is, whether it's you're having a reactive airway disease or you're having, chronic bronchitis, there's certain guidelines you want to follow, which I'd like to cover now. And that's removing these common causes and supporting the respiratory system. First, no cold foods, no cold air, no cold water, and definitely no ice cream. Doesn't matter if it's a dry cough or the burning cough or the mucusy cough, the ice cream's going to make it worse. The mucus, of course, will make the dairy in ice cream is going to make the mucus more. The coldness is going to make the restriction greater, and it's probably the worst thing we could do is having cold food with a respiratory issue. Another home remedy, of course, is the neti pot. I forgot mine, didn't quite make it here today, darn. I'll have to just imagine it's here. You put the salt in it and with some warm water and you pour it through your nostrils one at a time. So it goes in this nostril with salt water and then runs out this side. This is very good at disinfecting the nasal passages, good for avoiding respiratory infections, and also cleaning out mucus. And the salt is not just cleaning, but also hydrating, so helping to hydrate the nasal passages as well. So neti pot, being in a warm room, warm showers, steam, and of course, many people use eucalyptus. We all know eucalyptus. You know, you can get eucalyptus balms and put it on your chest and help with breaking up the mucus, the congestion. You can inhale eucalyptus steam. So there's so many things that we can do. It's very important that we take action quickly when we have a type of respiratory condition like this. And also another important tip where we're on these home remedies is don't lie on your back in most cases. You want to lie on your side, and you want to be expelling the mucus. So don't be in a cold room, be in a warm room, and good to have a humidifier. You get these little humidifiers in the pharmacy, and you put they have a little pocket there for their oils or things, and you can get eucalyptus oil and put it in the humidifier, put it next to your bed, and you got that steam and that eucalyptus coming up, and you're there breathing it in, and then has the tissue there and be cleaning it out. Because once you have the mucus and congestion, this is very dangerous. It can encompass the move from the upper respiratory area where we have upper respiratory infection, and that mucus and phlegm can move to the lower lungs, and then this can be life-threatening. So it's very important to decongest and expel out this mucus, and there's many ways to do it. So and sleeping on your back is only going to make it worse. So hot shower, steam room, eucalyptus, humidifier, these are all good because they're the opposite of the cause. The cause is often cold. It's making it worse, and dry. So the humidifier is wet and moist and hot. And the eucalyptus, of course, as we know, it's an expectorant and a decongestant, exactly what we need. So you could be inhaling that eucalyptus steam, and there's other things you could do, other essential oils you could put in there besides eucalyptus. If there was burning, you could use lemongrass. You could even use ginger, steaming ginger. L-champagne is very effective. I have a tea using L-champagne, but you could just boil L-champagne, pushkar mul as it's called in Ayurveda, and just inhale that steam. So even just hot water without even any essential oils, steaming, you put a towel over your head in a bucket and you steam it out and clear it out and spit it out. So it's very important to keep the respiratory system clear. So if you have any blockages in your nasal passages, see, they both should be clear at all times. And it's important to keep them clear. And that's why the neti pot is an easy way to decongest. So almost all respiratory conditions, whether you have dry, mucus, or mucousy respiratory conditions, we generally stop dairy, except for ghee. If you have a dry respiratory condition where it's dry and your bones are cracking and your hands are dry and your feet are dry and the whole body's dry and the joints are cracking because there's not enough fat, then actually increasing the fat in the diet, ghee in particular, or some oil, butter, will actually help the condition. But in most respiratory conditions, when there's mucus, phlegm, or we could say it's productive, that all dairy should be stopped, particularly cold dairy like ice cream. How many times have I nailed ice cream already? We're only 15 minutes into this, and I've repeated it many times. Don't have ice cream when you have a respiratory congestion. But yogurt also is equally as congestive, and snacking on tea. And in fact, another cause of respiratory congestion, probably the most common, particularly when it's not chronic over 10 years or when people have just had it for months and it's not going away, is actually their own digestion. Once the digestion is weak and you don't have much appetite and, you can go all day without eating, then there's too much stomach mucosa in the stomach and not enough acids, hydrochloric acids and peptic acids able to come out to stimulate your own digestive fire. So you're not hungry all day. You may think, well, that's wonderful. I'm not hungry all day. I can lose some weight. One, you may not need to lose weight. You just may want to. Two, it's not a good sign that you're not hungry all day. It usually means your digestive system's also just as congested. So when it's congested, you're not hungry. I mean, that's the blockage in the digestive system when there's no appetite. So, and that's too much mucus in the stomach that's blocking the stomach acids. And due to the proximity of the stomach to the lung, particularly the left lung, this mucus affects the left lung in particular, and then you get mucus and congestion just from your own stomach. So that's why when you have the dairy and the cheese, it's making more mucus and congestion, affecting your lungs and getting into your blood as well, and making your blood thicker, increasing the cholesterol. And this can have an effect on your respiratory health and create more mucus. So generally, if you have mucus and congestion, there's no dairy, none, and no cold food, no cold salads. In fact, almost anybody with respiratory problems, there's no salads, there's no smoothies, no juicing. And again, let me say it one more time, there's no ice cream. There's hot tea, hot soups, chicken soup, and spices, of course, are very important, like ginger, cumin, coriander, black pepper, maybe the best. Okay, here you go, folks. Here's a great home remedy for you. It's just coming to me. I didn't remember. Honey with black pepper. Oh, this is working fantastic. But honey's good for respiratory problems. And in fact, when I get to showing you some of these herbs and herbal products, most of them are best taken with honey. But here's the home remedy. Get some raw honey. You can't get the processed white sugar honey from Vaughn's. It's got to be raw honey. Doesn't have to be the expensive Manuka honey from another continent. It should be your local honey, particularly if you have an allergy. So, and then get some black pepper. Now, most of the time we get black pepper, it's not ground really fine. So you have to get the black pepper corn even and put it in a little coffee grinder, blend it up so it's really fine like powder. And of course, you're going to be sneezing just blending it up. Just blend that black pepper and then inhale that coffee grinder. Oh my God, half your respiratory problems are going to be gone. Your eyes are going to start watering. Your nose is going to start watering. And that's what you want. But you got the idea. Better than lying on your back in an air-conditioned room having ice cream, getting worse. Smelling black pepper is a better move. So get a little bit of this really fine black pepper, maybe just a quarter teaspoon, and then get a tablespoon of honey and get that quarter teaspoon of black pepper and just mix them together right there on the spoon. Take that down. And that starts clearing you up. And the honey, of course, is also an expectorant, a decongestant. The black pepper is pungent and hot, breaks down phlegm, mucus, destroys the membrane of viruses. That's quite useful. So, black pepper is very effective in many respiratory conditions. And to get big doses in you mix it with the honey. So then you're able to take more. So that's a great home remedy. But even just a tea, ginger, cumin, tulsi, if you have it, and black pepper tea with honey. And now, of course, whenever you make a tea, you can throw all those spices in together, throw in some hot water, boiling water, let it sit, and don't put in the honey right away. You got to wait until the water's warm. If you pour the boiling water on the honey, you kill all the bacteria, and technically you make it a toxin, according to Ayurveda, that it becomes toxic once you cook honey. So make the tea first, and then when it's warm and you can drink it, then put in your spoon of honey and just let it melt in the warm tea, and then drink that all through the day, and you'll be surprised. I do a lot of Skype appointments, and I tell these little home remedies to people, get them off the dairy, only spicy foods, hot foods, warm foods, drink a lot of soups, no salads, no dairy, no cold foods, have like onions, garlic, black pepper, things that are, breaking down mucus, onion, garlic, soup with spices. And you could put other vegetables, squash, zucchini, pumpkin, sweet potato, carrots, fine. And make a soup. And then drink this soup with this spices in it. And then drink the tea during the day. And I tell this to people, and, of course, get a humidifier, maybe get an air filter for your room too if you have allergies. So they do a lot of these things. And then I mail the herbs to them. So they're not getting the herbs for like 3 days after the appointment. And many times people say, my respiratory condition, which I've had for over 10 years, is 50% better before the herbs even arrived. That's right. So, it's very important to remove these causes. What we did was we removed the causes. The soup didn't treat it, but the cold food was making it worse, was one of the causes. And the soup allowed, it to start to improve. Now, ultimately, the condition could have come back for the individual, but then the herbs arrive, and the herbs actually do the work and actually help the respiratory system improve, breaking down the mucus. They're working as decongestants, expectorants, etc. So I hope you got some of those home remedies down, some of that diet. Now let's look at some herbs that we can use. Probably one of the best herbs that's an expectorant or decongestion is L-champagne. There we go, L-champagne. It's called lung tea, providing relief from respiratory congestion, coughs, asthma, and bronchitis. Being a tea, it's not as strong as a powder, but that L-champagne root is first. And that tea all by itself is very effective. Now, coltsfoot, you'll notice that coltsfoot is also in my cough tea as a first ingredient. So this is good for coughing, comfrey, marshmallow root, or slippery elm. These are demulcents that are helping to lubricate the lungs and help with dryness and pain. Mullein, also a very known herb for the respiratory system. In fact, you can smoke mullein and lobelia together to get stop smoking. And then licorice root is also kind of a catalyst to bring everything together, and also demulcent herb and mild antiviral qualities. Ginger, adding the heat to the whole formula. And there it is, black pepper, our superstar. Even though it's in a very small amount, this helps to really penetrate the mucus and stimulate our stomach acids and improve our digestion. As I said earlier, when you have poor digestion, your respiratory condition can get worse, and you can have a lot more mucus. So this is a great tea there, lung tea, great for mucus and congestion. When we were in Ojai after the fire, then a lot of people had that tea, and even a month after the fire, I gave that tea to people, and they spit out black mucus a month later, and only when they had the tea. They had the breathing problems, so then I gave them the tea, and then they said, wow, within days they were spitting out phlegm, because these L-champagne in particular is the main ingredient, like half the tea. That's the expectorant and decongestant, and makes you spit out the phlegm and mucus. And drinking the hot soup and staying warm, keeping the chest warm, putting, balms on the chest and taking hot showers to loosen up the mucus, and then taking the tea and spitting it out, you can make a lot of progress all on your own. So here's another product, cough tea, and this soothing, irritated cough. There's mullein, remember we mentioned first, and coltsfoot is known to suppress coughs. Slippery elm and licorice is the soothing aspects to take the irritation away. So we only give this one out if there's a lot of chronic coughing, particularly dry, painful coughing. And now if you get an infection, then we go, you have to take some herbs that are for the viral infection. And there we have, just like the sage, like the American Indians did, echinacea for the immune system, Oregon grapefruit, that's for the infection, oregano leaf, also for the infection. You can do oregano leaf oil, is also very effective. There's licorice again, because licorice is good for the lungs. It's a demulcent, it's soothing, it's antiviral, and a little thyme, ginger, and cinnamon to round it out. So this is one for viral and bacterial infections and supporting the immune system. So in other words, you have the flu, you would take that. Only start taking that once you actually have the symptoms. If you're just worried about catching the flu or infection, then you can have, the immune tea. Now, this immune tea, it says improves immune function and prevents cold and flus, but it's actually helping the respiratory system because the main ingredient, Tulsi, just I have 3 types of Tulsi here, Rama Tulsi, Varna Tulsi, and Krishna Tulsi, but basically Tulsi is 70% of this tea, is good for not only the immune system, but coughs, colds, respiratory conditions. In India, when anybody has a cold, they just give them Tulsi tea with honey. Now, we just added some cinnamon bark, a little ginger for the heat, and of course, black pepper to really keep the digestion strong, or the agni and the fire, and to help breaking up this mucus. So this would be for, mild sniffles and prevention of a respiratory condition. Now, if we have more serious condition, we have to take a churna or a powder, because that's only coming in a tea. And often I combine the two together anyway. So remember earlier I talked about you have to classify your respiratory system in terms of productive. See, this one is productive cough. This is Ayurvedic formula for productive cough, for respiratory congestion, mucus, snoring, cold asthma, it's called, bronchitis, and a productive cough. So you take 1 teaspoon frequently with 2 or 3 cups of warm water and a little raw honey, and make it kind of like a syrup, and take it throughout the day, and follow the diet that I suggested for that respiratory condition, with mucus, no dairy, no heavy foods, really no animal protein if you're overweight, and a lot of hot, warm soups and spices. Now, this one is for the non-productive. See, Ayurvedic respiratory tonic, non-productive. This one's for difficulty breathing, painful breathing, dry cough, dry asthma, and bronchitis. And again, the instructions are similar: 1 teaspoon frequently, with 2 or 3 tablespoons of warm water and raw honey, and make it like a syrup. And you can see Tulsi is one of the ingredients in there. And we can also see Vasaka. Vasaka is a bronchial dilator, opening up the bronchi and helping improving breathing. There's licorice again, fennel. Guduchi is like an immune modulator, and Kantakari is for coughing. So if a person has a lot of coughing, we can increase the Kantakari. If they're having difficulty breathing through the bronchial, we can add more of that Vasaka, and we can combine it with the tea. So, for example, if you have a very productive cough and it's definitely mucus, congestion, snoring at night, difficulty breathing, snot, all that, we'll just take both of them. You take the productive formula and put it into the lung tea and drink it all day, and follow the dietary guidelines. It starts improving very quickly. And maybe if you had like a painful cough with difficulty breathing, you'd be maybe taking the cough tea and add the non-productive respiratory tonic to it with the honey, and drink that all through the day, and you'll find the bronchi open up. Now, of course, in Ayurveda, there's many other types of even lehams. These are like jams that have herbs in it that you can lick them throughout the day. And tonics. Here's a tonic here. We call it the lung tonic. And this is to improve breathing capacity. It's a bronchial dilator, anti-asthmatic. And you can see the first herb is Vasaka again, which was in both of those other formulas. And now this one is, it's called Vasakadi Arishtam. Arishtam means it's fermented, but the first ingredient is Vasaka, and then watery, jaggery, cinnamon, cardamom, and a few other herbs and spices. Trikatu means ginger, black pepper, and pipali. So this is very good if the person's having difficulty breathing, and helps people to get off of inhalers very quickly. So is a possibility a person could be taking this with the non-productive with one of these teas. So, the combination that tends to do the trick. And here's El Champagne too, which is just in powder form, and that can be put in a formula. And they're different. Here's that Vasaka. It's called Vasa here, but that's basically Vasaka. And Kantakari is used for coughs. So if a person has a lot of cough, then we can add more Kantakari to the formula. So that's why, it's very important to have these formulas customized to you. So if you have 2 people next to me and they both have bronchitis, they could get completely different herbs and maybe even different diets as well. And even if they were both productive and a lot of mucus, maybe one has a cough and one doesn't. So they could have different herbs. Maybe one has a drier cough than the other one. So we would adjust that. So once again, here's that Kantakari. Yep, Kantakari. And, it's usually mixed with other herbs like I said, it's in these formulas that I talk about here. See, Kantakari is in there. It's one of the ingredients. See, right there on the bottom next to Guduchi. So formula is working better. See, it's a formula. It's called Stipulati Churna, which is 5 herbs with Tulsi, Valsaka, licorice, fennel, Guduchi, Kantakari, and Abrakpasma. See, it's that formula together that works the best. And sometimes people are a little dry and a little mucousy, and sometimes I'm even getting both of them, mixing them together, and then giving it to the patient because that seems to be what's necessary. And that's why you really have to make these herbs, we have to kind of customize them for the individual. So respiratory conditions are, treatable very easily in the beginning, and you don't want them to progress too much and to become infected. And then if you have infection, you could have more mucus, and it becomes even more important to discharge this mucus. Now, we're not really going into infection here because there's completely other herbs. We have respiratory infection formula for dry cough. We have respiratory infection for productive cough. So we have 2 sets of respiratory infection formulas too. So these are completely different herbs because there we have to add in the antiviral, antimicrobial herbs as well. When we could use a formula like Mahashundrashan, or we could use a little neem and other antivirals in combination with the herbs that we talked about here together, mix them together. So we fight the infection as well as improve the respiratory system. So maybe you're asking, how long would I have to take this? Well, people take these herbs for 2, 3, 4, even 6 months before their respiratory tissue is healed. And this is the beauty of herbs, is they're actually doing something healthy. They're actually, in this case, clearing the lungs. You could say that lung tea is kind of like a detox tea. It's detoxing your lungs. That's why I gave it out after the fires here, because people had a lot of soot and in their respiratory system, and they had difficulty breathing. And that tea alone was like a lung detox for them. So if you've been living in a polluted society or a city, or living with or around a lot of people who smoke, then you could have damage to the alveoli and the hairs inside of your bronchi, and have inflammation and pain there. And so certain herbs would be necessary to bring down that inflammation and pain as well. So, herbal treatments working quite well, but I would first always change the diet as I recommended. Hot, warm foods with a lot of spices, no cold foods, no dry foods, no crackers, no chips. It's just drying you out. And no snacking, and keep the digestion strong. Don't be snacking all day, eating late at night, no yogurt at night, no dairy at night. And don't do bad food combining like yogurt and fruit together, because this ferments and creates mucus and ultimately can lead to respiratory congestion. So most patients are creating the problem to some degree. And that's why it's so important to diagnose what you're doing or the patient's doing, and help them to identify these causes, which could just be bad habits, like sleeping all night with the air conditioner on, or eating ice cream at night. Oh, I got ice cream again for the 10th time. So I hope you got the point. Instead of ice cream, you're having hot ginger, black pepper tea. Instead of cold salads and smoothies, you're having hot soup. See, it's very important to understand the concept, of clearing the system. So I hope that helped you. And of course, if you have any difficulties or you have a very chronic respiratory system, then please contact me. I'm happy to do an appointment with you on Skype, diagnose your respiratory condition, give you dietary guidelines, some home remedies, and then mail you the necessary herbs that you can take over the next few months to allow your respiratory system to recover and improve your longevity, because the respiratory system, of course, is very important to our longevity and how long we live. So hope that helped you as much as I can on a webinar. And again, Feel free to contact me if you need more assistance in addressing your respiratory condition or any health issue. Thank you.